Welcome to The Explainer. Today, we're diving into a digital command center that's built to solve one of modern medicine's biggest headaches, and in the process, give doctors back their most valuable resource, their time.
So let's start with a question that honestly is pretty frustrating. Why do doctors spend almost half their day buried in paperwork? It's a staggering reality that leads to burnout and, it directly impacts the care that patients get every single day.
And this isn't just some minor inconvenience. It's a huge obstacle to quality healthcare. I mean, every single minute a doctor is clicking through forms is a minute they are not diagnosing, not treating, and not connecting with a person who needs them. So what if technology could finally, get out of the way and actually start to help?
Well, how do you give doctors their time back? You build them a digital command center. So let's take a look inside this dashboard and see how it's designed to streamline their entire workflow. Okay, first things first. It all starts with the schedule. Managing appointments can be a total mess of phone calls, sticky notes, and manual calendar entries. This platform takes all that chaos and centralizes it.
This is all about real-time clarity and control. A doctor can see their entire day, their entire week laid out perfectly. Smart reminders automatically ping patients, which totally slashes those costly no-shows. And what if something changes? A single click can reschedule an appointment and instantly notify the patient. This isn't just about being organized, it's about reclaiming hours of precious time.
Next up, and this is absolutely critical, we have patient information. Just finding the right file or a specific lab result at the exact right moment can be a huge challenge in a busy clinic. A digital system brings instant clarity. Just imagine a patient's entire medical history, allergies, lab results, past treatments, all of it, securely accessible in just a few seconds. Doctors can update records on the fly, and because it integrates with hospital systems, that information is consistent everywhere. It means every doctor, every nurse has the exact same up-to-date patient story.
Now, let's talk about prescriptions. Writing and tracking them is another huge administrative task, and it has to be fast, but way more importantly, it has to be safe. So this system has a crucial layer of safety built right in. A doctor can generate a digital prescription in a snap. And here's the cool part. The system automatically cross-references it with the patient's history, flagging any potential conflicts or allergies. Then, that prescription gets sent directly to the pharmacy, which gets rid of handwriting errors and saves time for literally everyone involved.
And finally, the command center closes the loop with direct and, of course, secure communication. Because let's face it, healthcare doesn't just happen inside the examination room.
This is all about making follow-up care easy and accessible. So instead of playing endless games of phone tag, a patient can send a secure message with a quick question. A doctor can instantly share a test result. It even has integrated video calls for teleconsultations, bringing that whole doctor-patient relationship into one secure, convenient digital space.
And that really is the entire philosophy here. By cutting down on all that administrative work, the platform gives doctors back their time and their mental energy to focus on what they were actually trained to do: care for people.
But look, a streamlined doctor is only half of the equation. What about the patient's experience? Especially when it comes to one of the biggest hurdles to getting care in the first place: payments.
What we're seeing here is a fundamental shift in thinking. We're moving away from those complicated, bank-heavy processes that can actually stop people from getting care, and moving toward a modern, mobile-first system that's simple, instant, and works for everyone.
So what does that actually look like? Well, it means supporting your standard debit and credit cards for sure. But, and this is crucial, it also means integrating mobile money services like M-Pesa. This is a total game changer for financial inclusion, making healthcare reachable for millions of people who might not even have a traditional bank account. Now, of course, whenever you talk about payments, you have to talk about security. This platform uses multiple layers to build trust. So instead of storing your actual card number, it uses a secure digital token. All communication is encrypted from end to end. You add in modern security like two-factor authentication and active fraud detection, and you've got a system that's designed for total peace of mind. So when you combine an efficient digital command center for doctors with simple, inclusive payments for patients, you don't just get a piece of software. You create something much, much bigger. You create an entire ecosystem.
The first big impact here is transparency. Imagine never being confused by a medical bill again. With clear pricing, digital receipts, and transactions you can actually track, the system builds a solid foundation of trust for everyone involved, from the patient all the way to the hospital's finance department.
The second impact is really profound.
By embracing mobile money, this tech breaks down one of the oldest barriers in healthcare. It extends access into rural and underserved communities, making sure that not having a bank account doesn't mean you can't get medical care.
So when you put it all together, what you have is so much more than a doctor's app or a payment tool. This is like the digital plumbing, the fundamental infrastructure that connects all the key players in healthcare into one efficient, smoothly running system.
And that right there sums it all up. This platform is really built on a simple belief that when you seamlessly weave together access, technology, and trust, you create a system where healthcare can finally truly work for everyone.
It really leaves us with a powerful question to think about for the future. As technology keeps dissolving these logistical and financial barriers that have defined healthcare for so long, what new possibilities for human health are we going to unlock next?